Welcome to this lecture. In this we'll be discussing cerebrovascular accident, CVA, cerebrovascular accident, CVA. So CVA or cerebrovascular accident is a sudden interruption of cerebral secretion in one or more of the blood vessels supplying to the brain, resulting in permanent or temporal neurological dysfunction lasting longer than 24 hours. So in CVA, there's just sudden interruption of blood supply to the brain, which can be permanent or temporary, just resulting to lasting for 24 hours. CVA is the interruption or dismissal, diminished oxygen supply, and commonly cause damage and necrosis in the brain tissue because it's a local death of the tissue within a living organism. So if blood which is going to the brain is interrupted, it is what we call cerebrovascular accident. Blood which is going to the brain is disrupted or interrupted. It's interrupted, not disrupted. It's interrupted. This is what we call cerebrovascular accident. So it's just a sudden interruption of cerebral blood flow to the brain. It can, which results into brain damage or necrosis. So types of stroke. So stroke can either be classified as ischemic or hemorrhagic. So ischemic, we have 85% of all the stroke. Then hemorrhagic, we have 15%. Most ischemic stroke are either thrombotic stroke or embolic stroke. Therefore, stroke may be fall under the two categories. There's a thrombotic stroke. There's also embolic stroke. Also, there's hemorrhagic stroke. Causes of stroke. We have cerebral thrombosis. It's one of the causes of stroke or cause of CVA. So cerebral thrombosis is the most common cause of CVA. It is common in middle-aged and elderly people. So it results from obstruction of blood vessel by a thrombi or a clot, and has gradual onset. So when the blood clot is moving in the blood vessels, then when it obstructs the blood vessels going to the brain, this is what we call cerebral thrombosis. The other one is cerebral embolism. This is the second common cause of CVA. It occurs at any age, especially in patients with history of rheumatic heart disease, endocarditis, post-traumatic valvular disease, myocardium fibrillation, and other cardiac arrhythmias. So it usually develops rapidly and without warning. Cerebral hemorrhage is another cause. So there are three causes: there's cerebral thrombosis, there's cerebral hemorrhage, and also the cerebral embolism. So the last one is cerebral hemorrhage, the third common cause of CVA. Like embolism, it may suddenly occur at any age. Hemorrhage results from chronic hypertension, which can cause lapse of blood cerebral arteries. So if somebody has chronic hypertension, then it causes lapse of cerebral arteries, which will lead to interruption of blood going to the brain. That can also cause CVA. Risk factors of CVA. So we have history of atherosclerosis, hypertension, smoking, hypocholesterolemia, rheumatic heart disease, diabetes, mellitus. Between 60 to 75, of all stroke occurs in those ages. So if you're 65 and above, you're prone to have CVA. Risk factors, we are looking at lack of exercise, diabetes mellitus, cardiac enlargement, cardiomyopathy. A family history of cerebral vascular accident, arterial fibrillation, obesity, less hematocrit. Pathophysiology, what usually happens, pathophysiology in the change of the brain. The brain is unable to store glucose and therefore must receive constant supply of blood to provide oxygen and glucose. In addition, blood flow removes metabolic waste, carbon dioxide, and lactic acid. Interruption of blood supply to the brain for more than a few minutes can lead to death or cerebral tissue damage. This can cause death as well as varying degree of disability depending on the location and the amount of brain tissue affecting. So, any interruption in the blood supply to the brain affects the brain because the blood which is going to the brain carries glucose and also it carries oxygen and glucose. And in the process, waste products are excreted such as metabolic acid, carbon dioxide, and lactic acid. So any interruption to the brain, even for few minutes, can cause cerebral tissue death. And if it prolongs for a while, it can also cause disability depending on the location of the brain which is affected. That's the pathophysiology for cerebrovascular accident. Clinical manifestation of cerebral or signs and symptoms of cerebrovascular accident. They vary according to the arteries affected and the severity, extent of damage, sudden loss of consciousness. For example, the CVA is a sudden loss of consciousness or deterioration in the level of consciousness. There's also paralysis. Others are going to have either the left side or the right side of the body will be paralysis. So there's hemiplegia. If CVA occurs in the left hemisphere, if it occurs in the left hemisphere of the brain, there will be paralysis with the light and also vice versa. So if it's the left side of the brain which is affected, which means the right side of the human being, there will be paralysis of the right side of the human being. If the right side, the left side of the human being, there will be paralysis. In some patients, there will be a sudden onset of hemiparalysis, that's numbness, and also partial paralysis. Others, there's gradual onset of dizziness, mental disturbance, and seizures. There's also loss of speech in severe patients. There's also change in the level of consciousness, changes in the level of consciousness. Clinical features, difficulties with comprehension, they'll be having difficulty to talk, forgettiveness, there's really inconsistency, visual disturbances. Because of that, blood supply to the brain is being interrupted, so they are going to be visual impairment. There's loss of sensory perception, maybe difficulties in visual, tactile, and also auditory perception, emotional liability, and unpredictability. Diagnostic tests, history may reveal risk factors such as hypertension. So when you're doing history, discover that there is history of hypertension. You can do cerebral angiograph, which will show interruption in blood supply to the brain. If you do a CT scan, it shows defective structural abnormalities, edema, lesions. If you do an MRI, it will allow you to evaluate the lesion location and size without exposing the patient to radiation. You can do EEG, may detect reduced electrical activity of the area of the brain. You can do also coagulation studies, may show coagulation problems. You can do a full blood count, may reveal increase in hematocrit. Treatment of CVA, there's medical management common includes physical rehabilitation, dietary and drug regimes, and care measures to help patients adopt the specific diseases such as speech impairment and paralysis. So the treatment or management of the client with CVA, we have rehabilitation, dietary, and also drugs. So drugs, we have anticonvulsions, just as phenobarbital to treat or prevent seizures. So phenobarbital can be given 80 to 120 to 80 to 180 nocte, or you can give phenytoin 3 to 4 milligrams per kg body weight. You can give oxygen therapy. You can give between 3 to 5 liters per minute. You can give corticosteroids like dexamethasone 0.5 to 20 milligrams IV infusion to minimize associated cerebral edema. You can give headache analgesics such as paracetamol 1 gram PDS for 3 days to relieve headache. You can give anticoagulants such as heparin used in case of cerebral hemorrhage. You can also give warfarin 15 to 30 milligrams. You can give antihypertensive drugs such as calcium channel blockers such as nifedipine 20 milligrams BD for 5 days. You can also do intermittent pulse pressure ventilators. Complications of CVA, we have infection. There's usually as a result, there's infection as a result of the source of encephalitis, inflammation of the brain. There's brain abscess because of that interruption in the brain. There can be also pneumonia. There's also sensory impairment. There's visual impairment. There's aspirated pneumonia, contracture, post-stroke, depression. Aims is to maintain a clear airway, to maintain patient's nutritional status, to prevent complications, to rehabilitate the patient, to prevent injuries to the patient. Under environment, during the acute phase, the patient is placed in the quiet place free of disturbances. Also, protect the patient from injuries. We provide a bed with layers. The room should be clean, warm, and well ventilated to promote comfort of the patient. Also, to ensure a patient has a patent airway, ensure that oxygen apparatus and suction machines are available for maintenance. Maintenance of patent airway, loosen tight cords to prevent interference with normal breathing, aspiration of secretions from the mouth to the nose to maintain a patent airway, insert an artificial airway, and start mechanical ventilation. If unconscious, the patient should be nursed in recumbent position with the head near to the side to allow drainage of secretions. Observation, the level of consciousness. You can observe the patient using the Glycoma scale, which assesses the eye opening, the verbal response, the motor response as indicated of the level of consciousness. If it is increasing, it means the patient is responding, and decreasing is indication of deterioration of consciousness. You also observe the signs for increase in intracranial pressure, such as persistent headache, nausea and vomiting, in order to inform the physician for immediate intervention. Also, watch out for signs of pulmonary embolism such as shortness of breath, cyanosis, tachycardia, fever, and also change in sensory perception. Observe for vital signs such as temperature, pulse, respiration, to notice for any further deterioration to normal, and patients respond if patients are responding to treatment. Psychological care, provide psychological support and establish rapport with the patient and allay anxiety. Explain his deficit and strength in order to promote cooperation. Involve the loved ones in the care of the patient to make him feel loved and improve his care. To also explain the test, treatment, and rehabilitation to promote cooperation. Also, encourage the relatives and patients to ask questions to clear out misconceptions and lay anxiety. Also, you give someone who's suffering from the condition to come and talk. You can get someone who's suffering from the condition to come and talk to the patient in order to in order to for the patient to cooperate and also promote cooperation. Prevention of complications. Use the footboard during the uh, uh, feed period after the stroke. Also, you position the patient in an anatomical position to prevent contractures and deformity. You apply a sprit and press needed to support the limb in an anatomical position to prevent contractures. Encourage early ambulation according to the patient's ability to do so to prevent deep vein thrombosis. Nutrition and fluids. Maintain fluids and electrolytes in balance to prevent dehydration and electrolytes. Also administer IV as advised and never to give too much. You can increase intracranial pressure. Initiate patient on IV. Can give dextrose 5 as a normal saline to maintain nutrition. Okay. NG-tube feeding may be used if patient is unconscious for a long period to maintain nutrition status. As the condition improves, give light diet and progress to normal diet in order to provide the needed nutrition. You also remind the patient to chew on the affected side, on an affected side, to ensure food is properly chewed before being swallowed. Also provide oral care to promote appetite and also maintain nutritional status. Do not give solid foods to the patient who has dysphagia or one-side facial paralysis in order to prevent discomfort. Hygiene. Clean and irrigate the patient's mouth to remove food particles. Provide mouth facial eye care to prevent eye problems. Do bed baths to promote blood circulation and remove dead. Chainsaw lenient to promote patient's comfort. Perform intermediate or indwelling bladder catheterization during the active stage in order to ensure bladder emptying. Establish regular schedules for voiding, like every 2 hours. Once the bladder tone returns for bowel motion, you provide a bedpan and also steam the bed during to promote comfort and privacy. Eye care and pressure for prevention. Remove secretions with a cotton ball from the eyes. Install eye drops as ordered. Patch the eyes if you cannot close its eyelids. 2-hour retaining active states to promote pressure formation. Assist the patient with exercise to maintain muscle tones and promote blood secretions. Teach and encourage the patient to use an affected side. Communication. Establish and maintain communication with the patient and enable him or her establish and maintain communication with the patient to enable him and also to allay anxiety. If the patient has also voice, use methods of communication basis such as sign language, pen, and paper, so the patient is able to write and read. In acute phase, you provide the bell the patient to use when they need help. You also teach the patients and family about the disorder in order to raise knowledge levels and promote comfort at home. If necessary, teach the patient about self-care activities such as combing hair, dressing, washing, so that they promote self-care, esteem, and promote self-care. You instruct the family members in management of loss of voice, aphasia, loss of voice in order to avoid frustration of both the patient and loved ones. Uh, Involve the speech therapies available to assist with speech problems. Involve the physiotherapy to continue rehabilitating the patient. Also teach the patient and family on drug diet and also importance of reducing weight if there's obesity. Emphasize the importance of reduced death in order to promote full recovery, hit the patient on the knee to correct this factor to prevent recurrence of the condition. This is what I had for you in cerebrovascular accident.